Good morning. Today we're going to talk about metabolic syndrome. Yep, syndrome. Disorder, energy utilization and storing loss by a co-occurrence of 3 out of 5 of the following conditions are risk: race, obesity, diabetes. A, the risk of syndrome which affects 40% of people over the age of 60. Race. Hispanic in age seems to be a great risk of metabolic syndrome are people of other race. Obesity. Carrying too much weight increases the risk of metabolic syndrome, particularly if you have an apple shape rather than a pear shape. Diabetes. You are more likely to have metabolic syndrome if you have diabetes during pregnancy, gestational diabetes, or if you have a family history of type 2. Other disease, your risk of metabolic syndrome is higher if you ever had cardiovascular disease, non-alcoholic fatty liver disease, or polycystic ovary syndrome. How is it also known? It is also known as metabolic syndrome X, cardiometabolic syndrome, syndrome X, insulin resistance syndrome, Raven syndrome, name of the Gerald Raven, and Cow syndrome in Australia. Metabolic syndrome increases the risk of developing cardiovascular disease, particularly heart failure and diabetes.
Hi, it's Mike from Health Newswires, talking to you today about metabolic syndrome, understanding the dangers and the condition itself. Stay tuned. At the end of this report, I'm going to show you a free resource for you to take advantage of. You can start controlling your blood sugar right away. So metabolic syndrome is a confusing and concerning set of risk factors that significantly increase the risk of heart disease. It increases the risk much more than any one factor alone. So according to the American Heart Association, over 35% of Americans are diagnosed with metabolic syndrome, greatly increasing their chances of insulin resistance, heart disease, diabetes, stroke, and hardening of the arteries. While there are many complex factors that contribute to the development of metabolic syndrome, the main contributors to this condition are genetic, often lack of physical activity, poor diet, diabetes, and being overweight. Some factors for metabolic syndrome include excess belly fat, high cholesterol, high blood pressure, high resting blood glucose level, and insulin resistance, which is a condition where the body cannot use insulin or process blood sugar. Specifically, diagnosing metabolic syndrome can be tricky. There are common indicators that the medical profession uses to diagnose metabolic syndrome, and those include an increased waist circumference, and that's 40 inches or more for men, 35 inches or more for women, elevated blood sugar levels, triglyceride levels, and elevated blood pressure. While some people are genetically predisposed for developing metabolic syndrome, several lifestyle choices also contribute to the development of the condition. These choices include consuming over half of the daily caloric intake from carbohydrates, failing to exercise the recommended
General age Sensory coronary heart schizophrenic illness.
Healthy food choices don't really appeal to Jack. In fact, Jack hardly pays any attention to his health. He doesn't eat very well, and he isn't as active as he could be either. Jack knows he's a little overweight, but he feels fine. What he doesn't know is that years of unhealthy habits have put him at serious risk for developing metabolic syndrome. Metabolic syndrome is a silent but extremely life-threatening condition that can lead to heart disease, a heart attack or stroke, diabetes, circulatory problems, and kidney disease, all of which can have extremely serious complications. There are warning signs for metabolic syndrome, but all too often they are overlooked and ignored. Metabolic syndrome can be treated and even prevented. The first step is to recognize your risk factors for developing it. There are 5 major risk factors for metabolic syndrome. Obesity, which is defined as a waistline of 40 inches or more for men and 35 inches or more for women. This is the most common one. High blood pressure, which is blood pressure of 130/85 millimeters of mercury or higher. A high triglyceride level of 150 milligrams per deciliter or above. A high fasting blood glucose level of 100 milligrams per deciliter or above. And a low high-density lipoprotein or HDL level below 40 milligrams per deciliter for men or below 50 milligrams per deciliter for women. Metabolic syndrome occurs when you have any three of these risk factors. But just one risk factor or a family history of these risk factors is enough to increase your chances of developing it. You should also know that each risk factor is affected in a very big way by the lifestyle choices you make. However, the only way you can find out for sure if you have metabolic syndrome or are at risk for developing it is to visit your doctor and have yourself screened for each risk factor.
Your physical exam shows a high blood pressure, and your labs show high triglycerides and low HDL.
What?
You have metabolic syndrome.
Although you can't change the past, it's never too late to start taking better care of yourself and reduce your risk factors.
Urinate.
Dr. Ferguson, what is the best way to treat metabolic syndrome?
Well, metabolic syndrome
is insulin resistance, and so the treatment is to modulate the sensitivity of the receptors to insulin, and that can be done through diet and lifestyle changes. So first of all, the food choices for metabolic syndrome would involve a low glycemic index diet, and what that means is every food is given a glycemic index, an amount. When that food is consumed, how much does that food spike your blood sugar, raise your blood sugar?
Okay.
And if it's not much, then it's considered low glycemic index. If it has a large effect, if it really spikes your blood sugar, it's called high glycemic index. And so you want to avoid the foods that spike your sugar a lot, high glycemic index, and eat a more low glycemic index diet. And so that would be, things that lower glycemic index would be the more fiber a food has, the lower glycemic index it has. The smaller the portion size will have a less blood sugar spiking effect. Actually, having fat and protein incorporated in the food lowers the glycemic index. And you can see one of the problems in America during the low-fat craze was that a lot of foods, the fat was removed and sugar was added in, creating a high glycemic index type food, which involves spiking blood sugars. And over time, blood sugars just spike, and you get this yo-yo effect that over time causes more and more insulin to be released, and the receptors become insensitive. So one, food choices, low glycemic index diet. Two would be to eat small, frequent meals throughout the day. So you could think of it as like 5 mini meals, or breakfast, lunch, and dinner with snacks in between. And what that does is that keeps your blood sugars more even, and you get less of this dip and up and dip and up. Because every time your blood sugars spike, you get a corresponding spike in insulin, which over time makes your insulin receptors less sensitive. And the goal is to make those receptors more sensitive. So eating 5 mini meals, each one balanced with protein, carbs, and fats, so that it's more lower glycemic index, with more fiber foods like fruits and vegetables, and whole foods versus processed foods. When you process a food, it makes it higher on the glycemic index. So like a whole grain versus a refined grain, a whole fruit versus a fruit juice. And then within foods, certain foods are just naturally lower in the glycemic index. The next thing to do would be to exercise. Exercise has been shown helpful for metabolic syndrome. And, for some people, just get out and do anything.
Right.
But, start with just whatever you can do, whatever you're willing to commit to, and do that for a while until it becomes habit. And then, because for most people, the most difficult thing is actually making time for it and getting out and doing it. And once it becomes a habit, then you can increase it more. And you want to do, some aerobic exercise. Weight training is also a good idea, because weight training actually burns more calories per time spent than aerobic exercise, because you break down the proteins in your muscles when you're weight training, and then your body has to rebuild those proteins, so it takes a lot more calories. So you'll see a better response in normalizing your body composition. The fourth thing to do for metabolic syndrome would be to improve the sensitivity of your insulin receptors, and there are several ways to do that. One is fish oil, improves the sensitivity. So you can eat fish or take fish oil. And magnesium deficiency makes your insulin receptors less sensitive, and specifically in the periphery. So magnesium can improve insulin sensitivity. Alpha-lipoic acid can also improve insulin sensitivity, and we see in say type 2 diabetes patients who have peripheral neuropathy, or they can't feel, they have the sensation of not feeling things in their legs. High doses of alpha-lipoic acid can actually treat that very well.
That's an antioxidant, right?
And that's an antioxidant that's touted as one of the best antioxidants because its ability to be both fat soluble and water soluble. And there are several other nutrients that improve insulin's receptor sensitivity. So you can see the idea is to have less blood sugar spiking, improve that sensitivity, and get a person moving and get their blood flowing through exercise. And it's been estimated that that 90% of type 2 diabetes patients can be improved, if not cured, through diet and lifestyle changes. and that should be the first line therapy in every patient with metabolic syndrome or type 2 diabetes is diet and lifestyle changes, because it's cost effective, because it's sustainable, and because people just outright feel better and don't have to pay for large expensive drugs. But if your situation gets out of hand enough, you may need some medications for a time being while you get your lifestyle rolling. But essentially that's how you approach metabolic syndrome and type 2 diabetes.
Thank you very much.
Thanks.